There's a fast way to relieve hip pain, and you can start doing it in your living room. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Hip pain is a common complaint, and many people will experience hip pain at some point in their lives. One of the most common causes of hip pain is irritation of the bursa, the fluid-filled sac that acts as a shock absorber between bones, tendons, and muscles. This bursitis, trochanteric bursitis, is the one around the hip. This bursitis is typically caused by repetitive motions or overuse. You may feel tenderness or pain on the outside of the hip. You might even notice a snapping or popping sensation along the bony prominence on the outside of your hip with running or other repetitive movements. Here are some treatments you might try. Rest. Rest and activity modification can be one of the most important things you can do to get rid of this type of hip pain. Resting your hip and avoiding activities that aggravate it, like sitting for long periods of time or going up and down stairs, can be helpful. Avoid any activity that causes pain. Even if you might not be causing further damage, you might aggravate the pain and make it take longer to go away. Home exercises can be extremely helpful. You can sometimes find exercises online that you can do on your own, or you could work with a physical therapist to learn some of these exercises. Make sure that any exercise program includes exercises that strengthen the core muscles, the glutes, the abdominals, because those muscles play an important role in supporting the spinal column during daily activities like lifting heavy objects or twisting at the waist. Anti-inflammatory medications are some of the most commonly used treatments for hip pain. You can get them over the counter, or that you can get them prescribed by a doctor depending on your specific symptoms and condition. And then physical therapy, again, my favorite. It's a great way to get back to normal and feel better. It can help you prevent future problems, re-injury, loss of mobility. The physical therapist will teach you exercises that can be done at home to get you better quickly and safely. They can also help you determine if you have a more serious problem going on. And then if you have bursitis, you can do injections. Again, bursa are those small sacs of fluid that cushion the bones and tendons of your joints. If they become swollen or inflamed, again, that's bursitis. It can be caused by injury or repetitive stress on that area where you have pain. If physical therapy and home exercises fail to get you through that pain and some of the other symptoms of trochanteric bursitis, sometimes you can do an injection into that bursa, which can be effective. I'd love to hear about your experience with your hip injury. Leave those in the comments below this video. Just understand, if you leave a question about your hip injury in the comments, I can't offer you medical advice, but I might be able to answer your question in a future video. Make sure to subscribe to my channel. Click the bell to be notified when I release a new video or start a live stream, including my Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.